Hi, my name is Prof Papageorghiou, and I'm going to spend the next 10 minutes explaining why I think that we can improve ultrasound using artificial intelligence. You can see my declarations of interest here. Why do we want to improve ultrasound or imaging in general, and why do I think AI can help? Well, I think all of us have seen examples such as this one. This pertains to CT scans, but there are many examples and instances where ultrasound has not been used to its maximum extent. And we see this in our daily practice by the fact that we know that a large proportion of fetal anomalies, for example, are still not detected antenatally. Many societies around the world look to try to improve this, and many of them recommend, for instance, peer review. Radiology is really suitable for peer review because we do lots of screening and it's reasonably easy for someone else to look at our images. But it's very labor intensive. Because of that, most societies and associations actually say that the physician peer review is voluntary, or that it includes only a small percentage of random images. And actually, if you think about peer review, especially in the context of ultrasound, what you want is a really simple procedure that tells you at the time when you have the patient with you that there is a problem, rather than having to bring the patient back. So, can artificial intelligence help? After all, AI is really good at detecting natural images. When I say natural images, I mean everyday objects, such as dogs and cats. If you take lots of pictures of dogs and cats and you label them, as you do in this training data set, you can then train an algorithm, and the algorithm will become very good at detecting the differences between dogs and cats, even if it's a dog or a cat that it has never seen before in the training data set, as in this case, new images from a testing data set. And I say that AI is good at doing this, and we know that because there are large tests that are done every year of labeled images, over 14 million images on the ImageNet dataset. And every year there's a contest to see how high the error rate is in recognizing these images. And you can see here that in 2015, there was a landmark moment when artificial intelligent networks were able to, for the first time, recognize natural images with a lower error rate than humans. Now, you might say, well, that's fine for dogs and cats, Aris. What about medical images? Medical images, of course, are complex, but using the same principles, you can use artificial intelligence in medical imaging. For example, here in breast ultrasound, using prediction models, looking at computer-aided prediction models using neural networks in order to look for breast cancer in breast images. And here you can see an ROC curve, and you can see that the AI algorithm actually is as good or better in some instances than a sonographer. There are also AI solutions which may aid, as you can see here, the sonographer in getting a better four-chamber view by highlighting in percentage terms how accurate that four-chamber view might be. Fetal ultrasound images, of course, a little bit more complicated because the fetus moves, but here in this work from King's, you can see that you can predict, for instance, with a high degree of accuracy, transarticular head images, as well as transthalamic, abdominal circumference, etc. So could we support sonologists by automatically recognizing images as the ultrasound is being done and keeping track record, if you like, of the acquired images? And could we also check perhaps that these images follow the standards that screening programs tell us they should? In essence, could we replace a human peer reviewer and therefore be able to go to 100% peer review rather than the small samples because of the intensity of workload that a human peer reviewer would need to undertake? Well, this is exactly such a system. Here you can see me scanning a patient, and what the system is doing is recognizing that this is a sacral and lumbar spine, which is why that went green. We've now moved to thoracic and cervical spine, which is why that is green, and lumbar and sacral is white because it's not an appropriate image. It's appropriately magnified, as you can see in the green box at the bottom right. And gradually, this system will populate these little boxes and make sure that all the different parts are recognized. Here, for example, scanning again and looking at the face, looking at the nasal tip, magnification of nostrils. And as I scroll backwards into a suboptimal image, you can see how those go white and then they go green again as we move into the correct image. So we use the system to check scan completeness, first of all, so making sure that sonographers are collecting the correct images in terms of completing an anatomical scan. And secondly, we looked at image quality. So for example, here, I just give one example, and the head, in the head view here, the head circumference view, the transventricular view, we want to see the ventricles, appropriate magnification, cavum septum, etc., etc. And when we applied this system, what we found was that the automatic AI system performs as well as an experienced sonographer in peer reviewing the images. Please beware, the AI system does not do the scan here. It is peer reviewing the images that the sonographer has collected. But as the AI gets faster and is able to do this in real time, it may eventually be able to capture images as the person does the ultrasound scan. So you can see here that for scan completeness, the agreement between experts and the agreement between the AI system and an expert are equivalent, and the same is true for image quality. Here's a system on the latest GE system. We've picked here the Sonolist, and you can see here on the right all the different images that we want to capture. And as I'm scanning here, as I'm scanning in real time, what happens is that the imaging system is ticking off. In green here, you can see those images. So it allows me over time to ensure that automatically, I'm not doing anything here, I'm not interacting with the system at all, it's just working in the background and collecting those data as I'm scanning through the baby. So I think that this is real potential to improve our ultrasound imaging. We must be aware, of course, that AI is already part of our daily life, and deep learning is really good at image pattern recognition, often really as good as humans. It's very good at repetitive tasks, which humans sometimes get tired from. And these AI systems are now available in this latest GE release, for example, to support sonologists during screening. It allows real-time peer review to assess anomaly scanning images. And I think there's real potential here to improve workflow through automatic recognition and measurement eventually. Ultimately, this will help in anomaly detection. It may help in reducing scanning times, support in particular those sonologists who have just come out of training, who are still under training. It will ensure completeness of scans, not just for the sonographer, but also give reassurance to the departmental lead, increase the adherence to clinical acquisition protocol, and perhaps raise the confidence in the use of ultrasound in this environment. Whether this ultimately leads to reduction in medical legal consequences, for instance, or improves detection of anomalies remains a subject of future investigations. So I hope I've given you a brief flavor of what I think AI can offer in a fetal ultrasound, and I thank you very much for your attention. Have a nice Congress.